Hi everyone, welcome to my channel. I'm Dr. Reyhan, a pharmacist. Today we're talking about the common cold, what causes it, how it spreads, what symptoms to expect, and most importantly, what actually helps and what doesn't. What is the common cold? The common cold is a mild viral infection of the upper respiratory tract, for example, your nose, sinuses, and throat. It's not caused by just one virus. In fact, over 200 different viruses can cause a cold. The most common ones are rhinoviruses. Because there are so many viruses, you can get multiple colds over your lifetime, even if you already had one recently. How does it spread? Cold viruses spread mainly through close contact like shaking hands, respiratory droplets from coughing or sneezing, touching contaminated surfaces, and then touching your nose, eyes, or mouth. What are the symptoms? Cold symptoms usually peak within 2 to 3 days and can include stuffy or runny nose, sneezing, sore throat, cough, headache, or mild body aches. Most people do not have a high fever with a cold. Important point, many of these symptoms are not caused directly by the virus, but by your immune system's response trying to fight it. Natural course and antibiotics myth. Here's a key message. The common cold usually gets better on its own within a week. Sometimes nasal mucus turns yellow or green. This is normal and does not mean you need antibiotics. Antibiotics do not work against viruses, and unnecessary use can actually make things worse, causing side effects like diarrhea, allergic reactions, antibiotic resistance, or infections like C. difficile. So colored mucus is not equal to bacterial infections and is not equal to antibiotics needed. What actually helps? The foundation of cold treatment is simple. Rest. Drink plenty of fluids and keep warm. Water is best, but diluted fruit juice or squash with water is also fine. The goal is to avoid dehydration and support your body while it heals. Pharmacy cold medicines. Over-the-counter cold products do not kill viruses. They only help relieve symptoms and must contain a painkiller plus one or more of these. 1. Decongestants, for example, pseudoephedrine. They reduce a runny or black nose by stimulating norepinephrine release, which narrows blood vessels in the nasal lining, reducing mucus and swelling, making breathing easier. 2. Cough suppressants. Main example is dextromethorphan. It likely works by acting on cough centers in the brain. It interacts with receptors involved in neuronal communication. It's important to use it exactly as directed because high doses can cause hallucinations. 3. Expectorants. For example, guaifenesin. Not all coughs are bad. A productive cough helps clear infectious debris and eases congestion. Expectorants act like lubricants for the airways, increasing respiratory fluid secretion and making mucus less sticky and easier to cough out. They improve cough efficiency but don't eliminate it completely. 4. Antihistamines. For example, diphenhydramine or Benadryl. Histamine plays a big role in allergies, not cold, but studies show antihistamines can dry up a runny nose. First-generation antihistamines also affect brain chemicals involved in alertness, which is why they often cause drowsiness. Supplements and complementary medicines. There's still a lot we don't know. Vitamin C is healthy overall, but the benefits of high doses for colds are often exaggerated. Zinc is widely used, but evidence is mixed and still unclear. But honey stands out. Studies show honey can reduce cough severity. Just remember, honey should never be given to children under 1 year of age. So the bottom line, there's no cure for the common cold, but most people recover just fine with rest, fluids, or symptom-based treatments. Medications make you feel better, but your immune system does the real work. If symptoms worse, last unusually long, or feel concerning, always check with a healthcare professional. If this video was helpful, like, leave a comment, and subscribe for more pharmacist-led science-based content. See you next time!